Thanks for joining this recorded webinar about after-action report development. Specifically, we're going to talk about creating and implementing your improvement plan, but today we're going to focus on the concept and the tips and tricks for the experienced practitioner, and there is a longer version of this, and I'll talk about that in the introduction for those of you who may be new to the concept. But so if you found yourself here, this is for those of you who have a good bit of experience, and we're going to just try to share some tips and tricks for you on the topic of after-action reporting and improvement planning. So our agenda is to do a very brief overview of the after-action report and improvement plan. We're going to talk about developing that improvement plan, and particularly around the workshops and surveys and some of those tools for gathering the information that will then be input into your improvement plan. And then we'll talk about utilization of the improvement plan. And so once you go through all the work of creating it, trying to help you as the experienced practitioner or to utilize the improvement plan more. So who am I and why am I talking to you? My name is Will Moorhead. I'm the president and one of the owners of All Clear Emergency Management Group, and we were engaged by the Minnesota Department of Health on a series of activities around improvement planning and integrated preparedness planning. And the idea is that we provide some information to increase the awareness and understanding and capability of the not just health departments and tribal health departments, but really anybody touching emergency preparedness and public health emergency preparedness around the state. So our intended audience today, as I said, is those of you who are the experienced practitioners. You've written after-action reports, you've written improvement plans, you've read them, you've perhaps used them. And we're trying to take some information from your counterparts and mesh that together to share some best practice and some lessons from the more complicated and recent COVID after-action reports. Let me just blast through some information and give you the big picture overview of an after-action report, just so that we're all talking about the same thing. Now, I am using this analogy, and for those of you that have a good bit of experience with this topic, you will very much understand that an after-action report and an improvement plan is somewhat like buying a car. There are fundamentals in every car: steering, signaling, and braking, but there are variations of vehicles: pickups, sedans, convertibles, SUVs, two-seaters, third-row capacity. If you're towing an RV versus you have a need for speed. Those are all different cars that do the same thing. They're different automobiles that do the same steering, signaling, and braking. So our after-action report, the fundamentals are that we're summarizing activity, we're looking at some objectives from the response or the activity, and we're summarizing the strengths and areas for improvement in terms of those strengths and areas for improvement for how the objectives were met. The variations, of course, come about when we talk about the different preparedness capabilities, how we go about collecting data, whether it was an exercise, whether it was a planned event, whether it was a response. And so as we're thinking through today, we're going to look at some of the variations and how to address the fundamentals in light of those variations. Our after-action report, again, I'm talking to those of you who have experience with this, so we'll all agree that this is an analysis of what took place during an event or during an exercise, and it typically consists of a summary of the response, then the objectives that are linked to, in most of our cases, public health emergency preparedness or hospital preparedness program, those SPEP or HPP capabilities. But even if it's response objectives, they still somehow similar to communications or information sharing or incident management, those types of capabilities and objectives. We summarize our strengths, we look at our areas for improvement, and from that, we create an improvement plan that says this is what we will do to address those gaps or to maximize those strengths. Most of you know that there's not a required format for an AAR. We follow in that third bullet the Homeland Security Exercise and Evaluation Program. Most of us create an AAR or IP in a very similar way as HCEP, and I'll show you that in just a second. But if we're using that as a common way, what it's doing is that second bullet. It's incorporating the key elements in some sort of an organized and concise format. So it's that what happened, what was your response, what went well, what can be improved, and how are we going to improve. If that's our format, then today, again, we're going to focus on really trying to maximize that. Before we get there, I do want to reiterate, if you're doing this and you've done lots of these, you're probably like, yeah, we just have to do it. And I agree. There are requirements, whether it's CMS, Centers for Medicaid and Medicare, or TJC is the Joint Commission, or some state agency that says you've got to write an after-action report and improvement plan. There's some level of standard of care and or grant expectations that require us to do it as well. And what I mean by standard of care is it really has become what reasonable people and reasonable emergency managers do. And that's kind of one of the standard of care, what would a reasonable person in the same or similar circumstances do. If that's really the standard, we do this because we know it is appropriate post-event or post-exercise to determine what could we improve. Somebody may be requiring us, but also to minimize our exposure to liability, to say, hey, we've identified some gaps and this is what we're doing to try to improve on those. We also want to validate and support the effort. And so a lot of times if we can write an improvement plan, if it's an exercise effort or a real world response effort or a planned event, a lot of people put a lot of work into creating that. And so we want to validate and say, hey, this really went well. And although these gaps were there, this is how we think we can fix them. And then, of course, we need that record of activity, whether it's just for historical knowledge or, as I was alluding to, that legal documentation. It's important to show you did something and that you're addressing something, right? It's a worse defense should you find yourself being sued for negligence in a response. It's not a great defense to say, well, we don't really have any record of any of our training or our exercises, and we don't really record what we did in previous events when we had other emergencies. And so we haven't really been addressing anything. That seems a lot more disorganized and a lot more negligent than to say, hey, over the last how many ever years, these are the exercises we've had, these are the events we've had, we've recorded things, we have been working on improving, and although we haven't accomplished everything we set out to, here are the things we've been working on. That is a much better defense. And so this is sort of my sales pitch for learn and grow equals continuous improvement. And for those of you that have been doing it a long time, maybe just a shot in the arm to encourage you to say, hey, this is valuable time spent. I think you're all familiar with this, whether you use this format or something like it, but just by way of review, we look at our strengths on the left. We look at our strengths and areas for improvement. Under the areas for improvement, there's a section on references. So we refer to plans or policies or procedures. And then we provide some analysis of that area for improvement and then some recommendations for how to address that. Over on the right, you remember that if we have the area for improvement, we can have multiple corrective actions. And as we talk today, we'll talk more about that point of contact and a start date and an end date and those sorts of things. I don't need to spend a ton of time on organizing AARs for you, but I do want to tackle and make sure we're talking about some differences of exercises and response or planned events. The exercise comes packaged, ready to write an after-action report or improvement plan. So we have objectives because we created those when we created the exercise. And then we created evaluation criteria to determine or assess our performance of those objectives. And then we create a scenario under that. And if you're developing exercises, you know that creating your scenario last allows you to focus on what is it we need to test and how are we going to evaluate that. And I realize there's some overlap in creating your evaluation criteria and your scenario. But, you know, the example is if we said, hey, we need to work on one of our objectives is testing our mass notification system. There are lots of scenarios that test our mass notification system. So we can create whichever one of those helps us best test our objectives. However, if we say, oh, we need to do a tornado exercise, well, what for? What are we evaluating? What are the objectives around tornado impact? Unfortunately, the reverse comes true when the tornado occurs. The scenario prevents itself. And we create objectives as we go based on the way the tornado impacted us. Did it knock out power or did it take down half the building? Was anybody hurt or nobody hurt? So our response objectives get created based on the scenario. And of course, we don't create evaluation criteria in the midst of the tornado. So we have to look back and think, what information can we use to evaluate our response or implementation of those objectives? The development of exercise and response after action reports, it's not tricky. It just requires a little bit of focus, particularly on the response or planned event side. So in exercises are short time periods, the objectives are set, we have predetermined evaluation criteria, we know we have evaluators, right? And it's fresh on our minds because we're usually writing this soon after the exercise. When we have a response to a tornado or a response to some sort of a planned event, the Super Bowl has made its way to our jurisdiction, or the county fair has took place during our jurisdiction, and we activated our command for part of that. Those are usually longer lasting events. They're more complex. The objectives change and evolve. We don't have specific evaluation criteria. We don't have specific evaluators identified. And then you guys all experienced this. In COVID, we were reaching back, in some cases, to think back and try to recreate information for the after action report. So as we talk through developing the AAR, we're going to talk about how we build that out on the response side. Now, all the tips and concepts will translate to your exercises, but I think probably more useful for your response and planned event AARs. Let's talk about developing this thing. I've already said there's a summary of events. We list our objectives, or we structure the document somehow. We summarize what went well and what could have gone better. And so let me just talk through each of those briefly. And maybe this will, for some of you, help you think through some ways you can improve your documents or the information you have. Especially in a response, a timeline is a useful way to organize the summary of events, your activation, your response, activities, and then the transition to recovery. But you might also think about the functions or departments within your organization. Let's just use COVID as an example. It's fresh on our minds still, unfortunately, and it's a long event, so it comes with some complication. But the timeline could include functions. So you could have, let's say, a vaccine management function, you could have a leadership function, you could have something around disease surveillance or contact tracing. Those three functions or four functions, you could summarize them under response, summarize them under the recovery period. But this is just a high-level overview. And so I do want to reiterate that. I know a lot of you have written a lot of after-action reports, but it's a high-level overview. Just think about how you could say, okay, in the early stages, these are what our functions did. And then during our response, this is kind of what our functions did. And in a couple of pages, you're trying to summarize that. I'm not going to go through all three slides of these in great detail, but we did provide for you some examples just to trigger your brain. If you've been doing this, or maybe you've written a lot of exercise after action reports, but you've not written many in real responses, as we organize, and maybe it is by organizational structure. And so we say, hey, what were the objectives for the executive leadership team? What were the objectives for the mid-management? And what were the objectives for frontline staff? And then those are the categories or the groups or divisions of how we're going to place information and analysis. And we'll look and say, did frontline staff ensure that staff followed updated new procedures and policies? And we can then discuss that within and look at the strengths and areas for improvement related to that. We might do that by function: administrative staff, vaccine management, contact tracing. And so the bottom one says, ensure contact tracing staff are receiving appropriate rest and mental health support. So if that is one of our objectives, we can look at and organize the function of contact tracing and use that as an objective. We could do it by phase. We could say the virus is spreading to the U.S., the virus is in the state, the virus is in our facility or our area or our county or whatever our coverage area, and then we're recovering from the impact to the virus. You could combine all these, and you could say the virus is spreading in the United States, and then analyze the functions and what were the objectives for each function as the virus was spreading to the U.S. What were the objectives for each function as the virus was spreading within the state? But overall, I would highly encourage you just to pause and try to figure out a structure that looks like objectives, just like in an exercise, for your after action report. I think this one comes very naturally to all of us to be able to find the strengths. We look at what went well. I'm going to skip the second one for a second and come back to that. But These are the things that we write into our AARs to ensure they happen moving forward. And remember, and I'm sure you've all experienced this, that some items can be a strength under one objective, but an area for improvement under another. We can say, hey, we did really well in that we used our walkie-talkies, but we need to work on or improve the type of information we transmit over those walkie-talkies or something, right? So you can have a strength and an area for improvement that both would be called walkie-talkie utilization. The second bullet, I just want to encourage you, and this is for those of you that have been doing a lot of these, you'll understand one of the most common statements or strengths that we see in after-action reports, especially in exercises, is something around the wording of, it was really good that we were all here exercising, or we were all together during the exercise or something. That's just not really an actionable strength. If you could explain that and say, it's important that we at least annually meet and we review the emergency operations plan using some sort of scenario-based activity. That gives you something you can make action around. The action can be have an emergency preparedness exercise annually, or ensure that the emergency operations plan is tested in this way annually or something. But just avoid those feel-good strengths. And that's just my takeaway, because the reality is, if I said, how are you going to repeat, it's good that we're all together? Well, technically your Christmas party does the same thing, but it's not talking about emergency preparedness. And I'm not picking on you if you've ever written that. What I'm encouraging you to think about is, why did you bother to write it? There's something you hope you can replicate. And remember, you may not be the user of this after action report in the future. It might be somebody else. And so you really want to write it for them. Areas for improvement also come fairly naturally to us. What could have gone better? We'll talk about root cause analysis in just a minute, but I showed you and reminded you, I think most of you are probably using the information format of issue, observation, or root cause analysis, and then recommendation. So let's explain the thing, and then what are we going to do to address the thing? I give you a few examples here. These came straight out of some after-action reports from within Minnesota from COVID, and you can just see like planning chief depth of bench. And the idea was that there were strong ones early on, which is a strength, but then we see that as the time went on, there were not enough people trained to fill the role as exhaustion occurred. So the recommendation is increase the number of ICS trained staff in the planning chief position using ICS principles, processes, and tools. The other one might be hold annual training or exercise activities for trained personnel to increase familiarity or confidence in the planning chief position. So that's really my review of after action report improvement plan and what we're trying to accomplish. So now I want to talk through with you, and hopefully for those of you that are good at this, give you some tips on how to maximize that. Information gathering, there are lots of ways to do this. I just want to hit on a couple tools for gathering. We'll have workshops and surveys, and I'm going to talk about formal and informal workshops and the fact that you can have more than one workshop or series of activities that look like workshops. And then also you can have surveys, or you can intermingle the two of those things. The informal workshop, I will say, I separate this from a hot wash. It's a conversation with an individual or a conversation with small groups about the event. And it might be you sitting in somebody's office, and it might be you hosting some small group or department or function meetings. The reason I say this is separate from what I call a hot wash is I refer to a hot wash as being that initial debrief. Something like COVID, maybe it's a little different. In an exercise, let's say we have a tabletop exercise, we get through the last module of the tabletop, and then we do a brief 20-minute, hey, what were your initial high-level thoughts? That's how I refer to a hot wash. But in a response, gosh, this informal workshop might be your hot wash, right? It might be a conversation with individuals or small groups where you're just hearing their initial impressions. You're taking notes. And the reason that third bullet says reiterate survey, we recommend have a survey that you're going to send out to people. And so we're having this conversation, but we're going to send you a survey and ask you to expand on some of your thoughts. The beauty of these informal workshops is that you have a small enough group and you're gathering information with them, and they say whatever statement in that sub bullet there, hey, you said X. Tell me what event or condition or resource would help avoid that situation or challenge or issue. You can ask those follow-up questions in these informal workshops. I will say I highly recommend that you consider mental health support in any of the workshops. And I'll say this again about formal workshops. It's just been our experience that, especially in COVID, because of the stress and the duration of this event, a lot of people have said to us when we facilitated formal or informal workshops, a lot of people said, man, this triggered some stuff I just did not expect. And I mean, I've seen people tear up. They were stunned by the emotional response they had as they were talking back through and revisiting some of this. So I would consider at least having a mental health support resource available, maybe not physically available, but just tell them at the beginning, acknowledge that stress may come up and have a phone number or a person available that they can talk with, or maybe talk with your mental health person and see how they would want to handle that or want you to handle it going into these workshops. I just can't underscore that enough. We had a lot of experience with it post-COVID, and I think it's important for you to remember in this process. The additional considerations, I've talked a lot about hot wash, but this might be your informal, might be your hot wash. It may be separate. You're looking at what went well, what challenges occurred, or what didn't go well, and what needs improvement. So as you do that, also consider you could have some meetings or some debrief conversations around specific topics, exploring racial equity or exploring access and functional needs and equity issues. So there's nothing wrong with you having those workshops around those topics. You don't have to take on every topic in one informal workshop or in one conversation. Maybe a conversation leads to something that you say, hey, we need to come back to that. And so, again, I think the nice thing about the informal ones is you have that last sub-bullet. You have the ability to explore those innovative practices and things that you would incorporate into your daily work or your operations or your future responses. And so it just gives you that chance. The formal workshop, it's a little more difficult to do some of the analysis on the fly, but from the formal workshop, you could have informal workshops. And what I mean by that is you have a formal agenda and you're going to get a larger group of people together to talk through the event. This, I really think, is separate from your hot wash. I think your hot wash is more of a rapid debrief. And in the formal workshop, it's a defined group of people with a defined agenda to look at something, whether it's the whole event or a specific part of the event. I recommend as you get more formal, you really do need to organize around elements or phases of the response. Often in COVID, at least, it's been chronologically, and we say, okay, early in the response, let's talk about that. And now let's talk about middle of the response. And so maybe that's pre-vaccine, post-vaccine, because your activities and your objectives and all those things were different. So I think in your formal workshop, you need some sort of an agenda and I'll call it a structure to help you capture, because if you've got 50 people in the room or 20 people in the room, it's hard to keep everybody on track if you don't have that. Having that structure allows you to place information into an organized process so that you can then organize that information for your after action report. I recommend in a workshop also that fourth bullet, resources to capture information, incorporate Poll Everywhere or SurveyMonkey or some sort of an input form, small group discussions. I think you get more out of the time if you have a way that people can, I don't want to say simultaneously submit information, but perhaps while people are talking, you pause and let everybody answer a Poll Everywhere question or answer a SurveyMonkey question, because the quiet personalities in the room may not get a chance to speak, or somebody will have some insight based on what something else was said. But it does allow for that. I know I said I don't want to say simultaneous, but it does allow for multiple people to be inputting at once, so it's time efficient as well. You organize your themes into buckets, and most of you have probably done this in something where what I mean by themes or buckets is something will come up. Vaccine management might come up as a challenge, or it's come out in several ways. And so you write that on one flip chart. And then communications comes up as another challenge, and you write that on another flip chart or poster board. And then you can come back to those and say, what are the solutions to this communications problem? What are the things we need to focus on? Or what were the particular issues we need to focus on under vaccine management? What do we need to improve? And so the formal workshop, your facilitation, is some sort of a big picture dump, but it's really the analysis on those individual buckets. And that's where small groups are helpful. That's where the SurveyMonkey or Poll Everywhere tools are useful. But I would recommend you think about how you're going to facilitate this rather than just have a large group discussion, but you're facilitating it with the intention of capturing information for solutions. Again, I can't underscore enough, in these, I would also consider mental health support. Now, both of these can overlap with surveys. So what I mean by a survey is there are virtual surveys and paper surveys, and I'll talk about the content of those, but virtual surveys are easy to disseminate, but they're easy for people to forget about. And this is something like a SurveyMonkey that you might send out, or a Jot form. The other challenge is it's easy because you're sitting at your desk creating it. It's easy to make it very complicated or detailed. And so you really have to think about, as you're creating it, who's going to fill it out and how much time is it going to take to fill it out and what are you hoping to accomplish? That's that last bullet under virtual. You got to think about the data. If you just send 50 open-ended questions, you're going to get 500, well, you're going to get like 5,000 open-ended sentences. So it's a lot of data to manage and that you have to process through. So you really have to design your virtual survey, your electronic survey, in a way that creates the data set, not the particular data points that you're looking for, but it's creating information that's useful and manageable. A paper survey, they work great in exercises because you have people captive. They also work great in a formal or an informal workshop because people are there. You can hand them a piece of paper and then they feel obliged to hand it back to you. You cannot let them out of the room until they give it back to you. The problem is it takes a few minutes to fill it out. And then you have a stack of papers that somebody has to read through and process that information. So there are pros and cons with each, but I recommend, as I said, formal or informal workshop. I think having a survey that goes along with that, it's just layered process for capturing information. Again, I just want to underscore when I say content over there in the slide over on the right, consider how you're going to manage the data and consider the time required to complete it, because it's easy to write a complicated one, but still somebody has to fill it out and you've got to remind people to fill it out, etc. Regardless, as we get information, we're going to do some root cause analysis. And so I think most of you who have done this understand root cause analysis, but we're trying to identify a problem, get some information about that problem, figure out the things, the events, conditions, systems, people that created the issue. We want to know the root causes that led to this or that would lead to the next instance of that. The last two things are really important: mitigation, so that we can develop mitigation strategies and tactics. And remember, strategies are bigger picture, tactics are smaller steps to accomplish that strategy. There are a couple of ways to do that. There's the standard root cause analysis where we have a one-sentence description of the event. If you're looking at the graphic, and then that we follow a series of why, what happened, were targets, capability targets met, did discussion or activities suggest the critical tasks were executed to meet capability targets. We ask this series of questions. And then ultimately we come up with 1, 2, 3 root causes of the problem statement. And I think that's a common approach. If your brain works a little differently, there are fishbone diagrams. And fishbone diagrams start right and move left, and there's a problem statement. And then each branch, if you will, if you think about branches and leaves, each branch is a bigger picture issue, and then each leaf, or each, in this case, each rectangle is a contributing factor on that branch. So in this case, the issue is there's iron in the product is the problem statement. And so is that a measurement, a materials, a method, an environment, a manpower, or a machine issue? Those 6 things are the branches, and then the leaves could be things like the tools or exposed pipe or rust near the sample point. Any of those things, those leaves, help us get to the specific details. Or you could just look at it big picture. There's the effect, and then there are, in this case, there are 6 options, and each of those 6 options has 2 causes under it. So just thinking about What are the causes that create the effect? So however your brain works, what we're trying to get you to is to think through what are the categories of causes, whether they're tangible, it's people, if it's economic or external, if it's managerial. Interestingly enough, we didn't create this list. We've used this list for a long time, and we didn't create it just for this presentation. And what I find interesting, and I say we, there are lots of people who have contributed to lists like this. You know what's interesting is think about your COVID response. There were material, equipment, and method issues. There were tangible causes to your problems or your challenges. There were workforce-related issues like inadequate staffing. There were external issues like political influences. There were organizational, whether it was systems or policies or procedures. So that's what I think is interesting about this process, is it helps us analyze. And so I would just encourage you to think through how you're going to analyze your data. The reason we're talking about this now is if you're hosting workshops or you're disseminating a survey, I want you to think about how you're accomplishing that root cause analysis. Again, just some lists to help you think through plans, policies, skills and training of staff, equipment and technology, communications or messaging or media. We're trying to help you think through how you're going to populate your improvement plan. Your improvement plan is, again, we look at the objective, we look at corrective actions, and then we have information that says we've got to deal with some of this stuff, and how and when are we going to deal with it. The common example, I think you all know, is communications. We always say, oh yeah, communications failed. That's an area for improvement. All right, now let's put our feet to the fire. Is it the device? Is it the message? Is it the messenger? Is it the recipient? What is it that failed? Did our walkie-talkies fail, or did the person who received the message not do anything with it? Those are two different communications problems. This example is communication between functions. The analysis is during the drive-through mass vaccination clinic, there were several instances where the vaccination team, the registration teams, and the traffic team were unable to deliver information or make requests amongst teams. Each team operated on their own radio channel. Team leads could scan and hear. That's the analysis about that. Now, what is your recommendation? So there might be one or several things that you could recommend to address that. Another example, utilization of virtual joint information center. There's a lack of clarity around the membership of the virtual JIC and not fully utilizing that. So recommendations might be developing a process to quickly approve requests. Another one might be something around developing an onboarding tool or a training tool on how to effectively use the virtual JIC. Again, if you've done lots of these, I want us to reiterate that how we create our workshops and surveys is hopefully informing the analysis and recommendations for our improvement plan. This is what I hope is beneficial to many of you. I say in lots of workshops that I believe the continuation or utilization of the improvement plan is probably the most important part of the topic, and we're often not great at it. Continuous improvement processes are not new, right? I have two graphics in here. This one says plan, execute, review, and identify. And if you follow that circle around, it's how the process can be improved. And then the execute is implement some changes. And the review piece is the continuous improvement or determining the effectiveness of those changes. And then the identify is identify the opportunities in each process to change or improve or whatever. So continuous improvement isn't new. I said there were two. The other one is this. It's plan, do, check, act. What are we going to do? Let's do what we said we would do. Let's check and see, have we met our expectations? And let's act. Do we need to make any changes? And where do we go from here? That's common. I think the challenge is actually getting the document out and doing this with it, right? We have a plan. It's the do, check, act that we're not great at with our improvement plans in some cases. So a couple of things to set the stage for our improvement plan is we need to keep the IP alive with a couple of concepts. One is leadership support. And somebody that's listening to this recording is undoubtedly saying, yeah, I wish I could get it. Listen, I understand, and that is a challenge. But there are lots of ways to, hopefully you can engage them to say, hey, we wrote this improvement plan And we think it's really important and you can refer back to some of those initial reasons that I mentioned about why have an improvement plan, whether it's liability protection or whether it's for grant applications or whatever. But gaining leadership support for the time it will take to develop it, the time it will take to address the things that have been identified in the improvement plan, as well as the effort and the expertise or the money that might be needed to do that. You also need a champion. The person at the top of the organization doesn't have often the time to do all the work to implement the improvement plan changes, but somebody that's cheerleading the process, championing the process, ensuring that we are acknowledging what's in there and that we look at the timelines and that we try year in and year out or month in and month out to look at our improvement plan. That person is helping to move it along. Acknowledging the utilization of the improvement plan is simply when we have an exercise that we say, hey, remember everybody, we said during COVID that we needed to address this exercise or this new plan or this new purchase is because of what we learned from you. Or when the improvement plan says we need to do some training or make a purchase, whatever it is, acknowledging that, hey, we heard you and we are following our improvement plan. And that's good for your people. It's also good for that liability or event to say, hey, we recognize our shortcomings and this is what we're doing to try to improve it. And also keeping this alive and using it in small bites not only allows us to eat the elephant one bite at a time, but it also allows us to have regular interaction with our emergency preparedness program. And I think this is vital. We've got to be able to month in, month out, or each quarter or something, have emergency preparedness be on our minds. If we do it once a year, it just sort of falls out of favor and for 11 months. And so I would encourage you to look at small bites for this. Some other thoughts for keeping this thing alive, in the small bite idea, tie it to your joint risk assessment or your hazard vulnerability assessment. And as you're going through that, look back at your improvement plan and say, what did we identify? Look back at your after action report and say, what strengths did we have? That gives you a better snapshot as to the accuracy of your assessment of your vulnerability or your risk. You can say, this is not actually the risk we thought it was because look, in our last after action report, we said we were really strong in this area. Or turns out we're not as great in this area and we've got some work to do. And that should change some things in your risk assessment. Tie it to grant funding or whatever projects you have, whatever funding request or personnel request, or however you're trying to demonstrate need, your improvement plan is a useful document for that. And then there's another webinar on integrated preparedness planning, the IPP and the Integrated Preparedness Planning Workshop, but of tying it to that and keeping it as part of that, tying your improvement plan to that is an important piece as well. That way you can say, based on our improvement plan, these are trainings we need, these are exercises we need, this is a purchase we need to make, whatever. It's helping to look at your preparedness as an overall project or program. I hope that those of you that have some experience with this, it's something we talked through that's triggered and you said, oh, yep, we could work on this or this we could improve or we could incorporate that. The idea is that you're gathering information and you're looking at objectives, strengths, areas for improvement, and improvement plan. I said this, there's a more detailed version of this recording, and I said the same thing in that recording. To people who have never done this, it's sometimes daunting to just get it all on paper. So I said to them, just get it on paper. If you've never done this before, get the information on paper and then share it with some key staff members. And it's easier for them to comment. It's easier for them to review. And then you can go and finalize it. But for those of you who have a good bit of experience with this, I think sometimes we get wrapped up in trying to get it perfect the first time around, especially when we're talking about a response after action report and improvement plan. I would encourage you to just rough draft some objectives, gather some data, look at the strengths and areas for improvement, and get that down on paper and then share it with some people. And they're going to say, oh, but there were these other strengths. Or they're going to say, yeah, but there's more detail around that area for improvement. And I would encourage you, don't strive for perfection in your first go around. Rather, get it on paper, and get it out to some of your key folks to help you write and expand and create the detail in your improvement plan. And then the last bullet there is really the most important, and I don't want you to leave that out. It's following up on the improvement plan. Make yourself drag that sucker out to read it and look at it on a regular basis so that you have the action items are part of the conversation around emergency preparedness in your organization. So following up on that is a real challenge, but I would encourage you to do that as much as possible. I make my contact information available a year from now and you're listening to this recording. That's fine. That's my email address. It's my cell phone. I'm happy to answer questions about something, give you some ideas, connect you with some counterparts that might be going through something similar. However we can help, that's what that's there for. And so I would encourage you on this topic. We obviously think this is a really important topic, or we wouldn't be spending time providing the resources and tools and trying to share some tips from your counterparts. So if we can help in any way, please let us know. Again, thanks for spending 45 minutes to do this, and I hope this is useful.